All right, welcome back. We're still in the first couple days of 2024, and I know a lot of people are thinking about their New Year's resolution. Well, if yours is to participate in Dry January in hopes of cutting back on the drinking habits that you may have had last year in this new year, whether you're concerned about your own habits or want to support a sober person in your life, we have got you covered. WMTV's Eliana Shriver spoke with a health specialist and addiction expert at UW-Madison about what you need to know as we head into Dry January.
What, from a health perspective, are some of the benefits for either reducing drinking or cutting out alcohol from your life completely?
Many of us think about folks who have really heavy drinking as the people who, are the ones most in need of a change, but don't always recognize some of the negative effects of more mild or moderate drinking. And so, some of the negative health effects that we see really with any level of alcohol consumption, but definitely the more someone drinks, the higher the risk, are things like elevated blood pressure or hypertension. We definitely see increases in sort of risk for dementia as folks get older. We also see increased risk for liver disease and increases in a lot of types of cancers. And so I think one of the tricky things, especially when people are younger, is that people think, oh, that's so far away, right? Like, I'm young, I'm not going to have high blood pressure, but it is really something that sort of after many months or sort of longer term use, even at lower levels, can contribute to those things. Other symptoms that people may have that they may or may not associate with alcohol, but we know they're interrelated, are things like sleep problems. So alcohol consumption definitely disrupts what we call sleep architecture, how good the quality of sleep we get is, which is often confusing, right? Because a lot of times people say, oh, well, I drink to fall asleep. But then when you fall asleep, the quality of your sleep is bad, so you still wake up tired the next day. We also know that alcohol consumption increases risk for depression and anxiety, and can often, again, in the moment might make people feel a little bit better, but then over time kind of has this paradoxical effect. So the short story is the more people drink, the higher the risk for all of these negative health consequences. Even if they're not even necessarily drinking to the level of being intoxicated, we just know that over time, more alcohol causes more health problems.
When would it be the point where you think someone should consider reducing their drinking?
I definitely have friends and colleagues who have decided to stop drinking just sheerly for health benefits at large, not because they feel like it's causing problems in their daily life, but like, I'll use breast cancer as an example. I have multiple female friends and colleagues who have a family history of breast cancer. They themselves don't feel like alcohol is causing them a problem, but because alcohol increases risk of breast cancer, they're just like, look, it's not worth it to me. I want to do everything I can. So I think, there are lots of reasons people may decide to stop or cut back, and they're all valid, and sort of concerns about mental health, concerns about sleep, all of those things are really valid. When I treat patients clinically, they usually come in because they feel like alcohol's really started to cause some problems in their life. And those problems can look all different ways. It may be that someone's having interpersonal problems, right? Problems with the partner, spouse, work problems, problems with family members because of their alcohol use. It might be that they've had some negative consequences, like they're having some falls, or they've been in a car accident after drinking. But in general, it's just that people are realizing that alcohol is now starting to cause problems in a variety of areas of their life. So lots of different reasons. And really, I think kind of all along the spectrum are really reasonable times for people to pause and say, actually, I think this may be causing more harm than good. And, I might want to cut back, or I might just want to stop drinking altogether.
What are some things that you suggest for people who are trying to reduce their consumption?
Sure. So first, this will be a really small proportion of people who drink, but for folks who are drinking every day and pretty heavily, especially if somebody has a history of ever having alcohol withdrawal that's pretty severe, needing hospitalization, we would never recommend for somebody to just sort of quote unquote go cold turkey. That can be actually really dangerous. So if somebody drinks daily in large volume, has a history of alcohol withdrawal, we would recommend that they get some medical consultation first, at least see a primary care provider to be able to talk through whether they, might need medications or other things to help. So that's first and foremost. But sort of for folks who don't meet those criteria, then I think it kind of comes down to really thinking about, well, what are the times when I mostly drink? How often, how frequently do I use drinking? Do I want to talk to someone, either a therapist or a primary care provider, to talk about medications that might help me reduce my drinking? Or, for example, sometimes folks say, oh, I only drink, a couple times a month anyway, or only drink a couple, maybe once a week. I think I can do this on my own. And then it's really more about making changes to your social environment and thinking about, okay, well, if I always drink when I go to, for example, a football game, or when I go ice fishing with my buddies, really kind of making a plan around that. Well, okay, you're probably not going to give up watching football if that's something you really enjoy, or, probably not going to give up fishing. So what are other things you could do? Are there other people you could fish with? Are there other things you could do while you're there? Do you want to bring a different type of drink to make sure that you have something and, are still engaging?
If you personally are not reducing your drinking, or that's not your resolution this year, but you have someone in your life who is working on that or is trying to stay sober, what are some ways you can support a friend or family member?
My experience is that different people have different preferences. And so I actually have a few close friends in my life who have made the decision to stop drinking altogether for a variety of reasons. And so usually I just start by saying, like, what can I do to be helpful? Because there's usually not one thing, and some friends might say, look, if you're going to be drinking, like, I don't want to be invited. Other friends might say, I'm okay if other people around me are drinking, but like, please just don't offer me alcohol, or like, please, like, I'd like to go to a place that offers mocktails. And so they may have kind of some of their own parameters. And so asking first and foremost, just like, hey, what can I do to be helpful? How can I support you? Is really always a pretty safe way to go. And then just checking in with people, like, hey, I know you were trying to cut back or stop, like, how is that going? And, what else can I do? It can really help people to know that they're supported. And then, if they're trying to pick up new hobbies, especially if it's someone close to you, like, if you're willing, right? Like, maybe trying to do some of that with them, just to make sure that they, again, have other outlets.
It's definitely good things to know, either for yourself or like if you are supporting a friend or loved one.